The chair would now like to recognize the Executive Vice President of the American Medical Association, Dr. James L. Madara.
Madam Speaker,
Dr. Madara.
Mr. President, members of the board, delegates, and guests. Conversations in medicine often note the rapid evolution in healthcare and how physicians, health systems, and patients have to adapt to that. And that's simply the nature of progress. It can yield incredible breakthroughs, but also induce a fair amount of anxiety. Consider this description of our nation. The American people find themselves consumed by mistrust and anger. Immigration is a hot-button issue. There is a widely shared perception that innovation is moving almost too fast at a pace once unimaginable. In parallel, inequality grows. Those with enormous wealth play an increasing role in politics. The country is sharply divided between red states and blue. In a surprise, a Republican candidate wins the White House while losing the popular vote. Sound familiar? Well, that happened in 1888. The AMA wasn't even a half-century old. Benjamin Harrison had just defeated Grover Cleveland for the presidency. And I add, by the way, that the Southeast and Texas were solid blue, and the Northeast and California solid red. So this isn't to minimize current challenges or discredit current anxiety, but rather to remind ourselves of the cyclical nature of events. The fact that all times have their challenges, and those challenges can even recycle. Simply put, by one view, we've been here before. For the AMA, our resiliency in such times takes root in our mission, which derives from the bedrock principles of medicine, and that emanates from this House. Those principles enable the AMA to be a unifying voice and a strong ally for physicians, as well as for our patients, and all for a healthier nation. Over the last several years, the AMA has refined its strategic approach, aligned with the changing needs of patients and physicians. We developed 3 strategic arcs, each anchored by one of the original focus areas. First, we reimagine medical education, training, and lifelong learning to help physicians throughout their careers. This began with our Accelerating Change in Medical Education initiative and evolved to include expansion of JAMA and creation of the JAMA Network, as well as our soon-to-be-launched Education Hub. Second, we improve the health of the nation by confronting the rise in chronic disease. We began this effort concentrating on prediabetes and hypertension, and we've seen these efforts evolve from pilots to emerging programs of scale. Third, we focused on professional satisfaction and practice sustainability, which has evolved to encompass our broad work to attack the dysfunction in healthcare, having the goal of removing obstacles that interfere with patient care and also waste the time of physicians. These efforts include our advocacy work, elements of our innovation ecosystem, and I'll touch on that in a bit, and our work on mitigating physician burnout. So here are some brief updates on work across these evolving arcs. This spring, we celebrated the first graduating classes from our ACE Consortium schools. Graduates that have been in the ACE Consortium since their entry into medical school. These tech-savvy physicians entered their residency with new skills and competencies proven by measurement, knowledge of what electronic records could and should be, a deep understanding of the social determinants of health, of population health, and teamwork within the healthcare environment. We've produced new physicians who are adaptive learners, capable team leaders, with a greater awareness of policy. This is a major shift in medical education. Consequently, this requires creation of resources for this new type of physician throughout her career. We now build on this success by extending these innovations to graduate programs in order to create a seamless transition from medical school to residency. To support lifelong learning and following nearly 2 years now of internal work, we'll soon launch the AMA Digital Education Hub. This education hub takes broad AMA content areas ranging from opioids and practice management to ethics and JAMA, all reduced to simple and effective learning modules that can be assessed by any means, desktop, pad, or mobile. We hope the hub will be attractive and sufficiently advanced that some of the societies might also consider using this platform. We've also just launched JAMA Network Open, our new open source clinical research journal. And this is the third new journal launched in the last 3 years, joining JAMA Oncology and JAMA Cardiology, which, by the way, are now great successes. Likewise, our leading work to reduce the burden of chronic disease by preventing type 2 diabetes and by controlling hypertension, it really continues to expand. Through various efforts, including our highly visible and popular national ad campaign, as well as our partnership with the CDC, the American Diabetes Association, and others, we've introduced prediabetes into the national conscience and inspired many to seek help through our defined programs. More than 1 million people have self-screened for prediabetes, either through the AMA's risk assessment site that's online or through their Samsung phones last fall. This shows how we are advancing from pilots to scale. That's also true of our work in hypertension. Tools we developed and tested in pilot settings have shown success in a range of practices across the U.S. So now, we partnered with the American Heart Association on another Ad Council campaign designed to increase public awareness of blood pressure and encourage patients and physicians to work together to get blood pressure under control. Our ultimate goal? All Americans with normalized blood pressure. Our near-term goal? By 2020, working with our partners, apply our tools to control blood pressure of 20 million Americans who are currently in need. 20 million by 2020. In the last 2 months, we partnered with Google and launched a corporate challenge to create a new means by which accurate home blood pressure measurements can be automatically collected in digital form, and not only be sent electronically to the patient's record, but also organized within that record. This initiative has already generated interest from more than 20 entrepreneurs. That work complements the AMA's Integrated Health Model Initiative launched last fall, an initiative in which various data elements relating to specific diseases or states can be better organized. IHMI also captures the key elements of patient goals, functions, social determinants, giving physicians more meaningful clinical data at the point of care, and doing so without paper shuffle. Currently, electronic records, some say, are reasonably organized for administrative workflow and even somewhat interoperable in that domain. What's missing is that second level of clinical data organization and interoperability, and that's what this initiative is all about. Partnerships are essential in advancing our work along the strategic arcs, whether we're creating new strategies around medical education and training, confronting the rise of chronic disease, or helping develop the technologies that will reduce the dysfunction that so frustrate us. For example, in our effort to extract greater meaning from health data, we have built relationships with some of the industry leaders in information and technology, including IBM Watson, Accenture, and two that I've already mentioned, Google and Samsung. Key in these relationships is that we define problems that need solutions from the vantage point of the patient-physician interface, not from the vantage of the administrative level. That means we're flipping the current construct for medical innovation, introducing a model that's been missing from our health system. And missing this has contributed much to the dysfunction that we see today. This is a bold shift, but I'm already seeing some evidence that this new thinking is taking root. At a recent high-level meeting of healthcare CEOs, the top executive from a large multi-hospital system said this to the audience, quote, "I went through a phase where I wanted to own the doctors, employ them so I could manage them. I no longer want to do that because I've learned that doctors are better at managing themselves." And he went on to say that doctors just need the time and support to do that, end quote. So you see, executives are starting to understand the importance of engaging and incorporating the physician perspective into new technologies, new strategies, and new systems, and those systems will be those that define the future of medicine. But better organized and meaningful clinical data is just one piece of the solution. We also need that data to be connected, and that's the concept behind the new company, Akiri, which is the first spin-out from our pioneering Silicon Valley innovation company, Health 2047. Akiri might be viewed as a utility for permissions-based and secure transport of health data. And importantly, it has been crafted to reduce cost and reduce effort while creating improved data sharing, an effort that has the potential to drastically improve the flow of data in healthcare, and what the field refers to as data liquidity. We anticipate other spin-outs will launch from Health 2047 later this calendar year. Companies that were created based on the experience and the expertise and the need of physicians. And that's the secret to the success of Health 2047. Flipping the model to define big system problems at the patient-physician level. We simply need to avoid what has happened in the past. Solutions created at the administrative level, then thrown over the transom to the site where medicine actually occurs, and often not working very well there. Now, I don't know what our health system will look like in 2047, the year of the AMA's 200th birthday. But I do know physicians need some major changes, regardless of what system emerges. Physicians need to be educated for this century, not the last century. Electronic clinical data needs to be much better and more meaningfully organized. Such organized clinical data needs to flow through an interconnected utility that decreases, not increases cost. And in the face of the still rising burden of chronic disease, we need both prevention and control approaches that are evidence-based and scalable. These are huge issues. some of the biggest challenges healthcare faces today. And the work ahead of us is not going to be easy. It will require years of focus and commitment on the part of the AMA and our partners. But this hard work, this work that is based on the policies of this House, has already begun. And we've gained footholds in these mountains that, in the recent past, appeared nearly insurmountable. Now, we also continue to move forward in our strategic arcs by deploying a really clever competency, and that's continuously placing one foot in front of the other toward a directed goal. And doing so in the context of flipping the model so that the physician perspective and physician experience becomes the driver of future innovation in healthcare. In moments like these, when chaos seems to encircle us, it's important that we pause and reflect on the really remarkable opportunities before us, on the cyclical nature of progress, and on that virtuous mission that guides our work, promoting the art and science of medicine and the betterment of public health. So thank you for all you do, and thank you for being the House of Medicine.